Antimicrobial resistance is everyone's problem. We are seeing increasing resistance, and that therefore means certain infections are becoming more difficult to treat, including those previously seen as being more trivial in nature. In fact, it's possible we may be going back to the 1930s in actually our range of antibiotics that are available to treat certain infections.
The Antibiotic Guardian concept is an extremely important concept which makes all healthcare professionals accountable for their use of antibiotics. Given the amount of lack of investment into new antibiotic production, it's extremely important that we preserve what we have. Otherwise, in future, we may not be able to treat serious life-threatening infections.
And that's a real problem. And it's also a worry that what are the drugs companies doing? We haven't had any new antibiotics for years and years. Penicillin is, we all remember the name of the guy, but what's happening?
In pharmacy, unfortunately, we do see a lot of people who aren't using their antibiotics correctly. You'll dispense a course to somebody 3 weeks later, you'll get the remainder brought back, so it's obviously a sign people aren't fully committing to their antibiotic course, and this is the sort of thing that really promotes antibiotic resistance. These bugs aren't getting their full dose of antibiotic, and therefore the bugs are becoming resistant to the antibiotics that used to kill them. Furthermore, it is a big waste of money as well, the money used on prescribing and dispensing the medications, and then the money resulting from the antibiotic resistance occurring, really. So that's why we want to make sure everyone's using things safely and appropriately.
So one of the ways we're trying to achieve this is to ensure that the antibiotic stewardship principles of safe prescribing, in terms of ensuring that a clear indication is marked on the drug chart and that a stop or review date is also marked so that we know the plan for the patient's treatment and it can be adjusted accordingly.
I think that patients are becoming increasingly aware that antibiotic resistance is a problem, and this may be manifest perhaps as people who have to return already for a second course because the first course of a different antibiotic was not effective. And this is the exact problem with antibiotic resistance. We're encouraging patients to think differently, as well as encouraging doctors to think differently. So we would welcome patients not coming to a consultation and demanding an antibiotic, but actually discussing with the GP what is the most appropriate course to treat their condition. It may be self-limiting, and over-the-counter products may be just as suitable and perhaps better tolerated than an antibiotic, with the same outcome after a few days anyhow.
I've signed up as an Antibiotic Guardian because I believe that we need to protect future generations. I'm currently, at the moment, I am taking antibiotics, but I understand that I need to take the full course, otherwise there's no effect. People who've got colds, symptoms, throat infections, I believe that antibiotics have no effect on those. So I think it's important that people realise why they need to take antibiotics and why they shouldn't. So,
based on the principles of antimicrobial stewardship, the Antibiotic Guardian is an extremely important concept that all of us as healthcare professionals sign up so that we use antibiotics prudently, use appropriately, and we complete a course and do not use it for everything what we think is an infection, but actually use it when it is genuinely needed.